Swati.
Dr. Jay Shankar speaking with Tony Blair there, chatting to Edie a little earlier. And later today, we're going to hear from Tony Blair live, looking at some of the other challenges facing the world as we emerge from this crisis. In that fascinating chat, hearing all about vaccine inequality, the global institutions that are now needed to lead the world out of this crisis, and of course touching on one of the big ESG issues, which is climate change, and we have a special panel addressing just that a little later today. At this point, let me welcome you wherever in the world you are watching India Global Forum, and our thanks to if you're watching on Republic TV in India, if you are watching or listening or reading through the medium of Khaleej Times in the Middle East, and also on the Daily Hunt news app. You are very welcome, however you are tuning in, to join us for a fascinating 2 days of discussion and debate. And so I want to kick off the first of our live sessions this morning, and we're going to look at healthcare, because the last 12 months, of course, have proved that it has been a huge challenge wherever in the world you are living. The healthcare system, of course, thrust into the spotlight, and the vaccine rollout program around the world, one of the key issues right now. But of course, successes and failures have been all too evident as countries deal with the crisis in their own way, with different resources and, of course, differing levels of success. And so for our first panel, I want to look at some of the lessons that have been learned from this and what healthcare systems around the world can do to make sure they are better prepared should this happen again. And so I'm delighted to welcome our first panel. Let me introduce you to them. With us is Dr. Sangita Reddy, who is Joint Managing Director of Apollo Hospitals, Dr. Swati Piramal, who's scientist and industrialist focusing on public health and innovation, also the Vice Chairperson of Piramal Group, and Arthur Kapoor, who is President and Chief Executive of the technology solutions firm HealthEC. A very warm welcome to India Global Forum to the three of you. I'm delighted to have you with us. And maybe, Dr. Sangita, I could start with you, and I want to ask each of you the same question to kick us off today. Give me your assessment of quite how the last 12 or 18 months has impacted you and your business, and then we'll come on to maybe some of the lessons that you've learned about your business as a result. But Dr. Sangita, let me come to you first.
So hello, and let me first thank you for once again highlighting what is so critical in the world, and that is healthcare and universal access to healthcare. So I represent the Apollo Hospitals Group, and over the last 500 days, I think it's been a period of acute and intense activity. We are cognizant of the importance of serving and the opportunity we have been given to serve people, and we tried to do so in a multitude of ways. So whether it was ramping up our online presence, enabling video consults so that people did not need to come in, it was training, building, creating more intensive care beds and more beds dedicated to the treatment of COVID. And then looking at the system in between, which is the fever clinics, the home health care. We tried to ramp up the entire ecosystem to serve during this period. And we have served almost 1.4 million people in the acute phase, and about 5 times that number in other ways. So moving on and really talking about the lessons that we have learned, I think, at Apollo. So while on one hand, we were dealing with treating and caring and had almost, at one stage, almost 4,000 beds dedicated to the treatment of COVID, we equally learned lessons like how important it was to do global collaborations. So along with GAPIO, we worked with doctors from across the world to ensure that all our doctors were using the latest treatment protocols. And as things kept evolving, remdesivir, tocilizumab, combination of cortisone, so the treatment modalities, then using technology to stay connected with your patient as well as with your internal teams. The other important lesson, I think, was really putting the healthcare workers and the teams first, ensuring adequate protection. We engaged hotels so that while they were on duty, they stayed in hotel rooms and they were not putting their family members at risk when they went home. Managing their psychological, their knowledge, as well as their physical well-being so that they were able to give the best to our patients. So that, I think, is a well-known lesson, but it keeps getting highlighted. Again, I want to reiterate technology. We used artificial intelligence and ML to create a risk scoring mechanism, and almost 18 million people took our COVID health risk assessment scoring, and from there we triaged them to the appropriate care protocol. Whether it was, stay at home and we'll give you teleconsult, come into the fever clinic, or get admitted because you are in a high risk category. So technology to do remote monitoring, technology to monitor every room, so the staff didn't have to go in there as much, multiple lessons. I think moving on, the importance of publishing. So we have published among the largest number of papers during this time because it was such an evolving scenario. I think the pandemic kept highlighting the importance of science, and I want to, also end this question by saying one of the biggest lessons is really that no one is safe till everyone is safe, and therefore we are doing our utmost on the vaccination front. We are currently vaccinating about 200,000 people a day. Our intent is to keep ramping that up because it is critical for India and therefore for the world for us to ensure that a significant number of our population is vaccinated. I think in final, I will just say that big lessons are learned when big changes happen. And with almost 4 million people who have lost their lives and the social and the economic disruption, this pandemic has really touched everybody. It's for us to come out of this, having learned these lessons, to be more humane and more inclusive, and yet ramp up our healthcare system to ensure that no one is left uncovered or untouched. Because the worst thing is having the science and having the knowledge and yet not being able to give it to people. And this is, I think, one of the biggest resolves we make, and that is to spread, to grow, to strengthen the healthcare system so that pandemic or no pandemic, we can serve everyone.
It is such an important message, and one that I think will follow us through the rest of the day when we talk about until everybody is vaccinated, no one is safe. Dr. Swati, let me bring you in here at this point too, because I'd love to know how you experienced COVID as an organisation, and what, picking up on what Dr. Sangita said there, what are the lessons that you've learned?
Thank you for inviting me today. And, for me, I was hearing Tony Blair and Jay Shankar speak just a few minutes ago, and it reminded me of the butterfly effect, that if a butterfly flaps its wings on one side of the globe, a hurricane can happen on the other side. It's a matter of moving molecules. But it illustrates how we all are connected all over the world. And today you see the Delta variant now occurring in many, many countries. So we represent the pharmaceutical industry, and that was an essential service globally. So all our 12 plants were running. They were producing drugs and medicines as fast as we could. We could ramp it up very quickly. And I'm proud to say that the Indian pharmaceutical industry really responded very quickly. For example, when the black fungus was happening, they could make tons of amphotericin B very quickly. And so there was no shortage anymore. And so that story is replicated because of its intense entrepreneurial background of the Indian pharma industry. So on one side, that was that, but the other side, I think philanthropists ramped up their efforts. We looked at looking at staving off hunger with migrant workers in Mumbai city, created millions and millions of meals for them. And then we looked at using the telecom network to protecting the elderly in all the poorest districts of India, rural India. So I think in 30 days, we made something like millions of phone calls to protect the elderly. And these people had never been called up. And these were all done by young people. So using their ability to call and to arrange medicines or whatever they needed was another way. And the third and most important way is to look at using digital technology. We do a mobile healthcare service in many states where we cover every single village, and that has an outbreak alert of communicable disease. So before the pandemic, we could look at dengue and we could look at other diseases, but this time we repurposed it to looking at COVID. And we could do it in the most remote villages of India, the states in which we were working on the ground. So, collaboration, looking at technology, and strengthening all the six parameters of healthcare. These are governance, financing, human resources, medical products and technology, information, and research and services. Services on the ground are the most vital. You can have a big plan in the center, but how do you reach a billion people? And the Prime Minister just today announced that he would increase spending on healthcare, which has been grossly underfunded over many years. And I'm so happy to say that increased investment in man, materials, and technology will help us overcome not only this pandemic, but prepare for the next one.
Arthur Kapoor, when you hear that conversation there talking about collaboration and technology, that must be music to your ears. That is something that you've been trying to convince the world that they need already, and that there must be more of that. You must welcome these advances in technology that allow collaboration across borders.
I do. Thank you for having me on the panel. But I'll tell you, I think the biggest issue that we have learned today is that the data has been sitting in different places. In US, we had a major issue with people not understanding where the data was. We couldn't figure it out, the comorbidities that existed. The patients were getting sicker because they had other problems before. So we have learned how to now manage data. We have two things. One is a data about a patient, which is your personal clinical record. And the second one is what happens once you end up in the hospital or with the doctor. Those two sets of data exist in two different places. They've never been assimilated together. They've never been aggregated together. My main issue was, how do we bring the data in and then make sure that there are a lot of other reasons of social determinants that kind of make the patients the way they are. It could be your diet, it could be your exercise, it could be a lot of those things. A lot of those things have not been put together in one platform or one place. So what you see is disparate data everywhere, and nobody can get access to it. Yeah. So what happens when these kind of things happen? You just don't know what to do next. So I think we learn from this, and I'm hoping that we can do much better. And these, the variants are going to keep coming. The new variations will happen. We are not done with this yet. So it's going to keep happening. But I think we are more prepared now than maybe a year ago.
Yes, yeah. Dr. Sangita, let me bring you in on that point, because it's so easy, isn't it, for us to look at so many industries now where technology dominates, data is prevalent, we have access to all this information. It strikes me in some cases that healthcare is having to play catch up, and it's taken a global pandemic to make healthcare providers think, hang on, we need to do something about this. Why is healthcare seemingly so lacking when it comes to using data?
So I think there are a multitude of reasons. Number one, and many of them are because of the large legacy systems. The other is that each healthcare facility exists in a silo. And the fact and acceptance and understanding of a concept of continuum of care and social determinants of healthcare and their impact on acute care. If we look at these two, it becomes quite intuitive for us to say that while in the hospital you need a detailed electronic health record, all other healthcare settings need access to this, but the patient should have their data, but actually not even the patient. Every healthy individual needs a personal health record. And this personal health record looks at vaccination schedules, diet, exercise, other factors which are the determinants of the future of their healthcare. Because while today we've all come together to discuss a pandemic like we've never seen before, there is a silent pandemic which has been growing in our midst for the last decade, and that is the pandemic of non-communicable disease. And non-communicable disease are influenced by lifestyle. So an appreciation of the fact that every day of your life has an impact on your health today and tomorrow, and an integration of that data into what the doctor is able to see, and then using technology to be proactive, to be preemptive about individuals, And the fact that the genome has enabled us to understand who has a higher propensity to a certain disease, and therefore some individuals may need to have their mammograms early or more frequently. Somebody else with a predisposition to a cardiac ailment should be very careful about all the determinants of that. So, appreciation of this, higher budgetary allocations, better infrastructure, and then bringing together the medical as well as the health aspects. And I say these very consciously as two different words. The medical and the health aspects of an individual must be brought together in a concept of a continuum of care, because honestly, it is very difficult for the world to afford high advanced care for everyone at the rate at which disease is growing. The only powerful solution for the world is a proactive preventive healthcare program, which is then connected to adequate treatment and curative resources. And as we redesign, as this pandemic has forced us to rethink every aspect of life, but especially of health, I hope that we redesign an integrated healthcare ecosystem which is powered by technology but centered around the individual and the concept of keeping him healthy, which is linked to the hospital and the medical ecosystem, which is based on science and new data. And all this evolves into this proactive, preemptive system where we focus on keeping people healthy. And when they are sick, we do the most scientifically appropriate treatment for them using new age, like our e-learning platform. Everyone knows that there were not enough ventilators. And when ventilators came from all over the world, were there enough skilled workers to use these ventilators? So we created this training program with a simulator, with a buddy system. So using technology to enable practical high-end care in the best possible manner and continuously evolving and training is another important aspect, because as change is the only constant, as this pandemic becomes endemic, as we see other aspects coming in to threaten our very existence, let us as a human race be prepared. And technology is definitely a powerful enabler. I don't think we have time, but I must mention 1 minute, the National Digital Health Mission of India is based on these very principles of an integrated view, of a single identifier, of providers coming together. So I think India is going to move in that direction. But I believe ultimately that a respect for human life and a respect for healthcare workers and doctors at large. We have Doctors' Day on July 1st in India. I think this is a great moment to also acknowledge doctors and scientists across the world who have done so much during this time.
Yes, absolutely. Arthur Kapoor, let me bring you back in here, because look, you know, we heard there about this, the lessons that have been learned and the need for collaboration and for that technology-led solution. How optimistic are you that that will happen?
I'm very, I don't think I can say I'm optimistic, because this needs a lot of work together. It's the public, the government, and the private has to come together. If they don't come together, nothing can happen. My biggest issue is the government still, and I'm talking about government generally, they are reactive later on, but they never are proactive, as Dr. Reddy said. We have to be proactive in making sure the records of people need to exist in one place. Now, somebody's going to fight about it. Who owns it? Who does that? If we can get past the issue of who owns it, I think we would be a better place. So if you ask me, am I very optimistic? Not 100% there, but I think I would say that we need to do something very fast to get over the issue of who owns it, but at the same time, bring everything back into one place so that tomorrow you can reach out to the people who have 5 comorbidities, then to get to the person who doesn't have that. So, you know, your time can be utilized better and you can reach those people better. And then what happens is, take care of them. The sickers, always remember, the sickest people are the ones who take your curve down. And if you can take care of that, you're in a better place.
Yeah, let me bring Dr. Swati in. Sorry, I'll come back to you in just a second, Dr. Sangita. But Dr. Swati, I'm interested in your perception of you know, what went wrong, because you know, India came in for a lot of criticism, India's response to this crisis. The criticism for many different reasons, and we know that right around the world there are very different issues at play, not least infrastructure. Was the criticism that India came in for fair, do you think?
We have been grossly underfunding healthcare for the last decades. And we really left it to the private sector to take over what the government should have been doing. And the public sector, which was very strong at the turn of independence, gradually gave its reins over to private entrepreneurs. So, therefore, public health suffered. I just want to give you a few figures. If India has 738 districts, they don't have enough epidemiologists. 11 out of 28 states have no epidemiologists at all. So, how do we look at the public health of those states? If you look at the number of doctors, you look at doctors, nurses, OBGYNs or pediatricians or laboratory technicians, in every number, there is a shortage 38%, 37, 21, 76, 34. I'm looking at every number in every district. And so we have been grossly underfunding. We spend less than 1 or 2% on healthcare. And I think that will radically change. We have no choice in the matter. And I think here is where the coming together of private sector, of entrepreneurship, of the digital technology, and people together and the public sector. We have no choice but to work with the government because only they can reach in the remotest parts of India. And together we can actually beat this very quickly. We have
And
shown it in many experiments.
yeah,
So I'm
sorry to
very
interrupt. I'm aware that time is really tight, and I just want your thoughts before we go on, whether the system is better prepared now, should this happen again, and if not, what needs to be done. Maybe you, Dr. Swati.
Yes, I think we have to prepare for the next pandemic and also for the next surge. For that, we need to look at health security just as we do for national security. It's that important.
And Dr. Sangita, is our global health systems much better prepared for this to happen again?
So definitely, I think we're better prepared. Is it adequate? We know that a third wave and the continuance is inevitable, but how much of it is mitigatable and how much have we done? I think that is still work in progress. But we definitely know more, and science has helped us considerably. The real need of the hour right now is to push vaccination and keep enhancing health infrastructure and keeping our healthcare workers active, motivated, and enhancing their status.
And Arthur Kapoor, is enough being done to nurture that collaboration that we've heard clearly needs to happen if we're to be better prepared for the next time round?
I think we are better prepared, but I don't know if we are there yet because this is not done. I mean, we are not even at the cusp of what I would call getting anything closer to saying, oh, we are better prepared for the next pandemic. What is happening is we are learning from experience. And that is what we are demonstrating on the next patient who walks into the hospital. But are we prepared, as somebody said, are we prepared to figure it out, the genome sequencing? Do we know who's going to get sicker? I don't think so. We don't know that yet. But can we be ready? Yes. Would we be totally there? No, I don't think so.
This is something we're going to come back to later in the day because particularly that technological response to this, I think it's so interesting, and the points that you raised there about access to our own data and whether we should have that digital passport that we take with us, including all that information. We will talk about that a little later in the afternoon. But my thanks to you for this first panel of the day, Dr. Sangita Reddy, Dr. Swati Piramal and Arthur Kapoor. I'm really grateful for your time today. Thank you so much. It's wonderful to have you with us for India Global Forum. My thanks to them and my thanks to you too. Remember, you can get involved in any of these sessions. Do send us your thoughts, your comments or your questions in all the usual ways. Use the Twitter handle IGF Updates and you can send in any questions through the question box on the website. indiaglobalforum.com is where you will find it. We're going to take a very short break. Edie will be back with the next session in just a moment. Do not go anywhere. We'll see you very soon.